even the traffic officer, they are just talking, but even them, they don't mind of the seat belt. They only check on the driver. Does the driver have a seat belt? After even though if the driver is not putting on a seat, for the traffic officer just allows him. He only wants to see overloading and this is last change only. They are the ones causing accidents with the Uganda. Then at the end, they come and talk about it. Thank you very much.
Okay, please, and thank you for being part of UBC and also for participating. Ground Zero.
Hello.
You're live and clear.
Yes, you're speaking with Obo Rogers.
Obo Rogers, calling from where?
Calling from Lira City West Division.
Interesting.
Yes. Uganda's the greatest problem Uganda have is as per the accident is with the police. One, if I'm still recalling my the traffic act which I read sometimes back, it bars anybody from sitting behind the lorry, the pickup, the what. But even I've ever been to Kampala. Even in Kampala, there you find people on pickups behind. Don't we have police in Kampala? Where I am, almost on daily basis, I find people moving to markets on lorries. And then you even find them at checkpoints. Then you ask yourself, the traffic law is talking of a different thing,
and they are doing a different thing.
They are doing a different thing.
Right.
If pickups and lorries are for carrying luggages, let them be for luggages purely.
Okay. Thank you, sir.
Yes.
Greetings, the people of Lila.
Thank you, I will do it.
Respect to all road users during the festive season is the topic that we are discussing tonight, and I'll get a few calls and I get back to the studios to answer those concerns. Live and clear on UBC. Live and clear.
Hello.
Your name again?
You are talking to Joel in Mbale.
Joel in Mbale.
Joel Nangoli in Mbale.
All right.
Yes, please.
Your concern, please.
Yes, I thank you for this topic. It's a very good topic, very important one. I think everyone should know that when you get into a car on the steering wheel, you must know that your life is between death and life. You must be very, very careful. Take all the precautions on the road. But you can see someone too fast on the road, reckless, I don't know.
Okay.
And anyway, I feel that all Ugandans take up this topic very serious.
Okay, sir. Thank you, Joel. That's Joel calling in from Bali, and many other Ugandans who are part of us from all sides of this country. This is UBC Ground Zero, and we're glad that you're part of us. UBC Ground Zero.
Hello.
Your name?
Yes, good morning.
A very good morning to you. Your name and where you're calling us from?
I'm calling from Ginger.
Ginger?
Godfrey.
Your name?
I'm Godfrey from Ginger.
All right.
I'm Godfrey.
Your concern, please, quickly.
Yes, I want to thank you for the program.
Welcome, sir.
I would like to thank the road traffic officers for the work they are well done. But the problem as we face as pedestrians on the road is these people drive these heavy vehicles.
Sorry, maybe you'll call again, Godfrey from Ginger, but your point was you have concerns with drivers who drive the time is not on my side. If we can allow me end here the calls, maybe the last one. UBC.
Yes, hello.
Your name and where you calling us from?
I'm calling local Michael. I'm calling from Namamve.
Namamve. Michael. Yes, Michael.
Yes, sir. Let me thank those prophets, yes, sir. But there is something I have seen here because where I work, I'm also working in private security. Where I work is just near where there is a traffic police.
Okay.
But those guys, I have seen them. Most of them have talked about that the way they carry people. In Namamve here, those people have got the way of getting money from those people of taxis. When they saw that taxi is overloaded, they just open the driver's door and the driver has to give them money on the hand and they put on a pocket. Then on the side of border, there are some drivers who ride borders while in the headset.
Okay.
Okay, sir.
Thank you so much, Michael. Part of us. Allow me pause calls for now, and I go back to the studios to answer those questions and concerns, messages, and also the callers. People, you're still calling in, but if time allows, I'm going to pick more calls later on. But I cannot forget the message from Catherine. It says ambulances are not fully established. We only have vehicles, but they are not ambulances in actual sense. The only problem, I would love you and your guests talk about insurance. In some countries, when you get an accident or someone knocks you, they just get out and get your insurance details and you all go ways, knowing that your vehicle or your vehicle is going to be worked on. But here in Uganda, someone just knocks you and drives away, even when he has killed a person. Also, Martin, you're also in Lila. He says health workers really needed to be disciplined. Sometimes when we take patients there, the attitude that we find with the nurses is disgusting, and sometimes and secondly, sometimes some hospitals, they reject to work on some accident patients, but send them somewhere else. By the time you're taking this patient is when they lose their lives. They need to discipline themselves and check themselves. They are there to serve the people, not to get that attitude. You have heard from the people of Uganda, so many messages coming in and so many people calling in, but if I allow me go to the studios to answer these questions. Let me start with you, Afande Bruce.
Thank you so much, moderator.
And our time is not on the side. If we can use a few minutes.
But the questions are many. Let me begin with the last one about the insurance law, comparing other countries with us, Uganda. It is true, most Ugandans are not benefiting from the insurance, but we have those ones that are comprehensive insured. I encourage every driver, if you have your motorcycle, if you have your vehicle, comprehensive insure your motor vehicle so that you do not get into trouble. Whenever a person is comprehensive insured, they don't get disturbed at the station. We just give you the police report, and insurance really covers. I believe we are going to get there. John Muyombi and Mary talked about corruption. It is true.
But as long as we have Kintu Kidogo,
it is true.
We are still losing people.
Some years back, one of the officers that I was commanding got 2,000 shillings from a truck driver. 5 kilometers later, the truck driver, the vehicle was a DMC. It was in a dangerous mechanical condition. The front tire jumped off, and that man ended up dead. I asked who has killed this officer. Yes, maybe he failed to maintain his the vehicle, but the traffic man who got the money is also responsible. Corruption is a vice. It has eaten us as the country. Not only traffic, and you know it. And it's two-way. You who has given out the money and the person who has received it. And it is a vice that needs to be fought by each and everyone. Henry Baguma says that enforcement is the challenge. He also asked about the law against the passenger. The law against the passenger is there. Several times we have charged passengers and pedestrians over carelessness. A careless pedestrian, you are on phone, playing music, you're playing football in the middle of the road and you're killed. Even you can be charged. Salome from Palisa is also blaming traffic police for causing accidents because of corruption, and we have talked about it. Oboho Rogers from Rila talked about passengers on pickups. Oboho, you do not read very well your traffic act. There is what we call the goods operators vehicle license. When a person gets that license, he is allowed to put some people in that vehicle, even if it's a pickup, so long as his license. However, we always talk about safe vehicle. The vehicle must be safe for that person who has sat there. Michael from Namamve.
There is a checkpoint there, but
yes,
it is no longer checking vehicles but collecting money from the road users.
From road users. He's also talking about corruption. But however, I want to tell Ugandans, whenever Uganda police is recruiting, we get these young officers from the communities. Do you know what happened, Mr. Ochiti? Happens?
No. We have type A, type B, type C. Type A are those rudimentary, empty ambulances that run around with sirens, with even no caretaker in them. We have now standards.
Why do we call them ambulances?
Actually, we are phasing out even the word. We're just polite because we are trying to resource mobilize to get newly equipped type B ambulances. But otherwise, we are phasing them out. By the time we started our work, we had around 125. Some of them that are even gone past being roadworthy. Some were bought during Chogam. Some were bought by, like-minded citizens, I don't want to mention different groups of people, okay, but we are trying to streamline. You see, we have developed ambulance standards and norms deliberately to guide on what an ambulance vehicle should be like. And what we are buying, the 225 so far, are fully equipped ambulances. So I just want to assure Ugandans, it's a long journey, but worth moving. If we need 504 ambulance vehicles and the country has bought 225 fully equipped ambulances, definitely we are going to get there. What they are talking about will eventually be forgotten. We just need to keep hidden and keep focused as citizens and as technical and political leaders of the country. Then number 2, yes.
Before you come to number 2, ambulance is one of the I call it a facility, I don't know, that helps in especially health facilities or hospitals, if I may call them. Do you think it should be a requirement for a hospital to start to have an ambulance? Because perhaps like in Kamori, someone gets an accident and runs to the nearby hospital, but they don't have an ambulance, yet he wants to be admitted to a better facility.
Thank you, Amon. I was trying to rush through the questions because of time, but there's quite a lot that I would share around ambulance vehicles and their operationalization. Now, in brief, we are moving away from facility-based ambulances. Current policy dictates that we establish community-based ambulance systems, but which are linked to facilities. And that's why you say, so to us as policymakers at the Ministry of Health, facilities are only ambulance posts. when we issue out this ambulance, because we also had issues, a facility would own the ambulance and think it is actually only meant to serve those that they wish to serve, because you know how some people, think when they are in positions of power. So what we are saying, these are community-based ambulances, much as they are posted or they are placed at facilities. It means there for you as a hospital director, a medical superintendent, and in charge, always remember that this is not your ambulance. It is the ambulance of the public. That's what we are pushing for. Even as we send them out. So that's why you hear us say these ambulances are going to constituencies, because we want to bring out that community-based, ownership of the ambulances. The other issue was about attitude. Yes, the attitude of nurses.
Someone is dying, but someone is busy on his or her phone.
We currently did a survey. Recently did a survey with Twaweza. I don't know if the public has heard about Twaweza. It's a civil society organization that picks a public opinion on different public services. And one of them this time around was emergency medical services, especially during COVID-19. What exactly transpired? What we picked is public facilities are those that register the poorest attitude. And this we have submitted to health, to top leadership at the ministry. The attitude is killing us, and of course there are quite a number of factors that you as a Ugandan should think about before you point fingers. Yes, we know we have the bad attitude, but what about the other factors around the provision of services in terms of numbers of patients vis-a-vis the number of health workers that we have in the country? Our annual health sector performance report indicated 75% coverage of health workers. Are they enough with the increasing levels of the ever-increasing disease burden in the country, including the injuries? Then number two, what about the health essential medicines and supplies? Do they have what it takes? Do they have what it takes to take care of the burden that they have at their facilities? We know there are wrong elements, and we are addressing it in all ways possible as a sector, but we also urge government to support us such that we do not have excuses from these health workers. We don't have supplies, even a bare minimum of a glove. Okay. What do you expect from such a health worker? But again, we encourage health workers to definitely take care of these people. Those should not be excuses as we push the country forward. Thank you so much.
Interesting. Charles Achiti?
Yes, please.
Someone sent a message from Montinda. It's called Michael, and says a traffic office is not a traffic police is not functioning. Either it needs to be re-established, or we need to bring in Special Forces Command or military police, the no-nonsense institutions, to save the people of Uganda, but also save the 5% of the GDP of this country. What do you have to say?
This is what I want to say to our listeners. Uganda Traffic Police is the most lenient police in East Africa. Otherwise, even the pedestrian would not be on the road because of the arrogancy that we have on the road. But you see a police officer still going down there trying to educate this person, please don't do that, do it like this. When it comes to our drivers and then the riders, not only borders, I can tell you, if the police officers, especially the traffic, are to enforce 100%, our road will be empty. This is why people get accident on the road. They are not compensated fully or at all by the insurance company. It is because we don't meet requirements. You'll find a person riding a motorcycle, does not have a driving license. If you get into an accident because you don't have a driving license, you lose. You are not going to be compensated because you have never been permitted to be on the road. Still, the police will come in and say, okay, we need to take this one to emergency unit, where my sister here will grab this person, whether they have a driving license or not, whether they were putting on a helmet or not. For as long as this person is an injured person, they will still take good care of. The attitude, yes, some attitudes are not good in the hospital. I wanted to just say a few things about the 4 E's that the officer mentioned. Number one, education. When you talk about education, it should not be a one-man thing. I think the different institutions that we have in this country, government should come in and ensure that this education is really emphasized on and something is done about it.
Okay.
Then the great numbers of borders on our road, can be turned out to be an economic benefit to government if properly addressed. There are a lot of loopholes. There are a lot of good things that I have seen in this. All we need is to come out with a policy that will ensure that we work together with these people in also changing a lot of things in this country. Okay. The second E is enforcement. Enforcement is being done by the police, but I think the numbers of police also on the road are outnumbered by the numbers of the pedestrian, and wherever they move, the drivers, they are just very many. The police needs to be equipped with the motor vehicles, motorcycles. Sometimes you find the drivers themselves help the police to take them wherever they want. They stop them, and the driver will say, okay, let me drop you wherever you are going. This is not professional. Let the police have their own motor vehicle where they can be dropped wherever they want to go. And then the third one is engineering. Big problem is here. Government has built good roads. Yes, I appreciate government of Uganda, especially our president, but there are some loopholes. There are gaps. I can tell you, for me, I was trained in this thing. You move on our road, moderator, you'll find that there are certain road signs which are put where they were not supposed to be. Overtaking in a corner. The person say you can overtake here. This is a mistake made by the engineers.
All right.
I have seen them.
Okay.
We don't have zebra crossings. There are a lot of things. It is just because of time that we cannot talk about it all. But for me, I have seen a lot. Like I have said, people of Kampala, we are coming.
All right.
We are coming to train people. We are coming to train you. Please, the day you hear about Upapa, please come and join us. And we save our people.
All right. Time is not on our side. We're coming to close of our discussion. If I can get one just caller to give us an way forward. UBC. I thought it would end with you. UBC.
Yes, I'm on Juma from the best roundabout Busega.
You have only a second, sir, because of our time.
Thank you. Festive season. Police of Uganda, we always follow them by name, a police. But what values do they add to the development of this country in terms of transport and the criminal matters? Let the citizen rectify their faults. Those who own CCTV cameras at their homes, it will help also security outrages. And you too, who is on the road, remember we have so many things on the road. There are people, we call them mad person. He will never wait for you. But now, how vigilant are you as a driver, a senior or qualified driver? Bosses who have drivers, make sure you check those drivers' capabilities. Whoever you knows is having some mistakes or errors, first for this festive season, remove this driver to rest.
Okay.
Okay? Yeah, let's make sure the reality be reality. And you should not condone any bad one coming from unprofessional persons to overtake from the public. Thank you so much.
Welcome, Juma.
Welcome too.
Today you didn't talk about corruption, and I know it was in the corner because of time. We cannot go. I see you people calling and sending in your messages, but time is not on our side. I beg and request you that we go to the studios for the way forward. Juma mentioned something very important that I never wanted to forget. Actually, I wanted to mention it earlier. The bosses and drivers, you have traveled perhaps from Lila to Kampala, and you have reached here at 2 a.m. in the night. You send this driver to go and rest. He gets a boda because you don't allow him to go with your vehicle. He grabs a boda and goes, maybe stays so many kilometers away from your place, and you also instruct him to come early in the morning, pick you to another place. By the time he reaches there, it is 3 a.m. By the time he's eating and reflecting and going to sleep, it is 4 a.m. He has to reach your place by 6 a.m. meaning he's going to rest for 1 hour, and then by 6 he's at your gate, gets in the car and starts the journey, maybe to the other side of the country. What did you expect this kind of driver? Of course, is tired, did not rest, and at the end of the day they cause the accident. Gentlemen and the lady in the studios of UBC, time is not on our side. I will request to give your parting shots and last comments on today's topic. Respect to all road users during the festive season. We're coming to Christmas where people have started taking in their holidays. What is your advice to all of them? Let me start with you, Chiti Charles.
I only want to wish well to all our drivers, but please listen to the instruction being given to you that drive to live but not to reach, because accident is real. If you want to drive to reach, you can reach even in the grave. If you want to drive to live, you drive, respect other road users, you'll drive and live for long, because I know you are there for your family, you are there to ensure that your children goes to school, but driving to reach will not let you do that. So please let us observe all instructions which were given to us, all the lessons we learned from our various driving schools. Let's put it to use. I wish you well during our festive season. Thank you very much.
Interesting. Maria?
Thank you so much. Dear listeners and fellow citizens, my humble plea to you, reminder is it is the responsibility of each one of us to make these roads safe. It's not just Uganda Police. I don't know why we always point. When I was growing up, actually knew it is the responsibility of Uganda Police. It's not just Uganda Police. It's not just Minister of Works and Transport. It's not just Minister of Health. It's not just the media, UBC, that is here. It's everyone else. You, as an individual, you're responsible for your own safety. And remember, this is a preventable tragedy. Losing 10 to 12 people every day in Uganda is we cannot afford that. We don't want you to be a statistic tomorrow. So we come back and report 10 to 12, and you're one of those 10 to 12. Please take care of yourselves as you enjoy this festive season. To wish you a Merry Christmas from myself, my family, the sector that I serve, and God bless you all.
Interesting. Afande, Bruce.
Thank you so much, Amon. I have 3 things that I want to tell you, dear listeners. Dear road users, because all of us are road users. People who are traveling, who are preparing to go to the villages, those ones who are coming to towns. Make sure that you have a safe vehicle. Service that vehicle. Get your tires on. Make sure you have your wipes worked on. Have a driving license. Have the insurance cover before you step on that road. The passengers on mass transport, speak up. Do not keep quiet. If you keep quiet, you're going to die. Mass drivers, the bus drivers, the taxi industry, Utof, the border that brings all of them, this is the time. Make sure that you talk to your drivers. Do not overwhelm them with a lot of work. Other than that, I wish you a Merry Christmas and a prosperous 2024.
Maybe to give you seconds, Afande.
Yes.
Also to help someone who is listening to us from the other side of radio. In case accident happens, what should I do?
In case an accident happen, we have our calls 999. Please call it. 999 will be able to disseminate information to the nearest traffic police there. Then, of course, make sure that we preserve the scene. Most of the times, what is happening in this country, after the crash, the person gets a smartphone. Instead of helping a neighbor who is suffering, you see him capturing you people. It is very bad. You take a video of a woman with a child crying, help me, and we are not willing to help. This is Uganda. Please let us tread the call.
All right.
Yes.
Indeed, Twedeco brings us to the end of our discussion today. Ampaire Amon Utega is my name, and we've been discussing respect to all road users during this festive season. Make sure you drive safe and reach safely. Mind your environment and be stable while driving. We call on all the institutions that are involved to make sure that we protect the people of Uganda. Indeed, we are losing so much money and so much in terms of lives, we pray that we all take our mantle on and take the responsibility, not leave it to the Ministry of Health, not to leave it to UPAPA, not to leave it to Uganda Police or Traffic Police, but it is a concern of every Ugandan. Twedeko, indeed, it was a privilege having you, Ochiti Charles, Chairperson Uganda Passenger and Pedestrians Association, and God bless you, sir. It was also a privilege and honor having Maria N. Nkalbu for the Principal Operations Officer, Emergency Medical Services Department, Ministry of Health.
Thank you, UBC.
It was also a privilege and honor having you, SP Bruce K. Oinebye, Regional Traffic Officer, Kampala Metropolitan North.
Thank you, UBC.
Interesting, and our dear listener who is part of us from the other side of radio, and those of you who sent in your messages, and those that called in. For God and my country, allow me now to sign out. For other programs are coming your way on Butebo Radio, on UBC Red, on Magic 100 FM, and Western Nile Radio. Keep it UBC.
That was Ground Zero Season 2, a production of Uganda Broadcasting Corporation, UBC, inspiring Uganda.